Do you feel dizzy? Do you have blurry vision? Even do you feel like you're going to faint? It could be that you suffer from low blood pressure, or as it's known in medicine, arterial hypotension. In this video, I'm going to tell you what low blood pressure is and how we can treat it. To understand more about this topic, we first need to know what blood pressure is. Blood pressure is nothing more than the pressure that blood exerts on the walls of the arteries. When that force exerted on the walls of the arteries is strong or very high, we can say that the pressure is high, and when that pressure is low, obviously the pressure decreases. To understand a bit more, there are two factors that cause the pressure to decrease or cause arterial hypotension, known in medicine as low pressure. Number one, when the vessels dilate, or when there are factors that cause the vessels to dilate. This is known as vasodilation. And number two, when the amount of blood the heart pumps decreases. Examples include hemorrhages. Now we need to know what the normal blood pressure values are and when we can say that we have low blood pressure or hypotension. First, we must remember that the pressure considered normal is 120/80 millimeters of mercury. And when do we say that a person has low blood pressure? Well, when they have a pressure lower than 90/60 millimeters of mercury. Here we are talking about a person who has low blood pressure or hypotension. With this pressure, there are people who may already show some symptoms of low blood pressure. Some of these symptoms include muscle weakness, and this is because blood, oxygen, and nutrients are not reaching the tissues and muscles. Well, obviously there is going to be a decrease, in energy, which obviously is going to cause muscle weakness. And also, as blood does not reach the brain, it can present weakness, dizziness, drowsiness, blurred vision, even tachycardia, known as palpitations. And these palpitations or tachycardia are due to the body wanting to compensate for this low pressure. That is, arterial hypotension, which causes the heart to speed up. The heart rate tries to compensate or solve the problem of arterial hypotension. Here, the patient may start to sweat cold, a kind of sticky sweat, and also the person may have a feeling that they are going to faint, among others. And you might ask, what are the causes that lead a person to have, low blood pressure or hypotension? Among them, we have dehydration, people who drink little water, or people who have gone a long time without drinking water. Or like intermittent fasting, where they consume no food for certain hours, and also, they don't drink water. It can also occur in people who have intense diarrhea, intense vomiting, and this obviously happens because there is dehydration. It can also occur in people who misuse diuretics, and also people who take the famous diuretic tests. No, to lose weight, what it does more than anything is to eliminate, liquid, and remember that the body needs liquid to be able to increase blood pressure. And obviously what it causes is low blood pressure. Other causes that can cause low pressure are people who have been lying down for a long time and who get up very quickly. This is known as orthostatic hypotension. This is sometimes something physiological, something normal that can happen to anyone who gets up very quickly. That's why it's advised that people don't get up too quickly from bed, but take their time, sit in bed, and then get up. But it can also occur in people who take vasodilating drugs, such as tamsulosin, or drugs that help control blood pressure. In these cases, if the person is taking a medication to control blood pressure, it doesn't mean they should stop taking it. Instead, they should consult with their doctor to change the medication or look for other alternatives. And there can also be a neurally mediated hypotension. This means that when a person is very nervous or experiencing intense emotions, this can lower their blood pressure, which can cause them to faint. This is often seen, for example, at weddings, when the bride is very nervous and obviously very happy. She's experiencing intense emotions, causing her to faint. The nervousness, anxiety, and everything, and it can also occur in people who have been standing for a long time without moving. For example, the military, who sometimes, when they are punished, they are made to stand in the sun for a long time. They can get what is obviously a drop in blood pressure, a hypotension. This does not mean that people who work in shopping, in stores, or who are standing for a long time are going to suffer from low depression. No, what happens is that these people who are standing for a long time without moving still can get arterial hypotension. But people who are working in shopping, in stores, are in constant movement, so obviously there is a circulation of blood. We are talking here about people who are standing still without moving. Now, the most important thing you might ask is, but how can we treat arterial hypotension, or known as low pressure? The first thing to do is to consume liquid, ideally water, coconut juice, natural juices. It's also important that if the person is with hypotension or low pressure, and feels like they're gonna faint, it's important that they sit down or lie down and elevate their feet. This will obviously help that there is a return of blood from the lower limbs to the heart, and it can continue pumping the heart and send blood to our entire body. They should remain lying down until the symptoms caused, obviously by low pressure pass. Another important thing is that people who take medication to control high blood pressure and feel that there is some change that is causing them low pressure, it is important that they go to their doctor. Why? So they can change their medication. Since many people sometimes make changes in their lifestyle, lose weight, and sometimes the dose they used to take is now too strong. And this needs to be communicated to their doctor. This does not mean that the person who has, high blood pressure should stop taking their medications. They should not stop taking it or switch to another one. It should be ideal for the patient. Always remember to go to your trusted doctor, Dr. David reports.